to loans, among others. This program airs every Wednesday on the network service of Radio Nigeria by 5 p.m. And I am your host, Itoro Etukudo. Today, we're discussing the sustainability of two crucial healthcare initiatives, the Basic Healthcare Provision Fund, BHCPF, and the Midwives Service Scheme, MSS. The BHCPF was created to ensure access to basic healthcare services, particularly in rural areas, by improving primary healthcare delivery and providing essential drugs and vaccines, while the MSS aims to reduce maternal and infant mortality rates by developing skilled midwives to rural communities. Sustaining these initiatives requires continuous funding, efficient resource management, and robust community and government support. To help us understand these issues better, we have with us in the studio Joshua Aroguyo. Is the Special Intervention and Evaluation Specialist. And also we have Nene Oche. She's a Healthcare Quality Management System Consultant. You're welcome.
Thank you.
Thank you very much.
Okay, and to you, our dear listener, the telephone lines for you to make your contributions are 0915 091 0482 or 0915 091 0483. You can also send your questions on WhatsApp to the number 0810 250 7579. I'll take that again, 0810 250-7579. We're also live on Facebook at the ICIR. Please don't forget to include your name and location. So let's head on to our discussion for today, and I'm going to start with you, Nene. So can you give us a brief overview of the Basic Health Care Provision Fund?
Yes, thank you very much, Taro. The Basic Healthcare Provision Fund was launched under the auspices of the Nigeria the Health Act of 2014, and the federal government signed it into law in 2019. Came into effect essentially in 2019 by the President Buhari administration. It seeks to help build universal health coverage, in line with that, actually, to help to fund the healthcare system in Nigeria, ensuring that primary healthcare services are made available to all Nigerians, vulnerable, more importantly with the focus on the vulnerable Nigerians, and helping them to gain access, improve access to healthcare, ability to take advantage of these healthcare services with or without minimize. So it has objectives of creating at least one primary healthcare center within each political ward in Nigeria, in all of the political wards across Nigeria. And then three secondary healthcare facilities in every political ward across Nigeria. So essentially, the focus is ensuring access to healthcare, funding that access, and making available 1% of the consolidated revenue of the country for this particular initiative.
All right, great, thank you. So back to you, let's get to you, Joshua. When we talk about midwife service scheme, what exactly are we looking at, and can you also give us its primary objectives?
Okay, thank you very much. I'm going to speak more in the context of the realities that we face in Nigeria, and those realities that the average woman encounters during the period of child delivery. So every woman, we know in Nigeria, we have a high rate of maternal mortality, child mortality, and this is actually a consequence of the fact we don't have sufficient hands in the healthcare system. We don't have sufficient nurses, and so one of the things the government tried to do is to create the midwife service scheme, and the midwife service scheme seeks to ensure that we have more midwives that are that can work in primary healthcare centers to provide support and to ensure that there's improvement in the quality of care at the primary healthcare centers. One other thing is that access, and of course these midwives will be trained, they'll be upskilled, and then to ensure that the incidences of maternal mortality is reduced. So that's the thinking about the midwife service scheme. But of course, in reality, while that is actually a very good idea and a good initiative, there've been little or no recruitment in the past years. Few states have done recruitment. Some other states they did once, and that was all. So what you see happening in the primary healthcare centers is that you have more and more midwives who are getting up to retirement age, and then you don't have new persons coming to take over from them. So that's the dilemma of the health centers at the moment. And so, I mean, the expectation would be that state government takes those initiatives, because it's actually supposed to be driven by the state government, to begin recruitment of midwives, upskill them, train them, and then deploy them to various facilities.
All right, so Joshua just told us the major challenges faced at the MSS. So how about the BHCPF? What are the challenges faced in that area?
The BHCPF and the MSS are actually very much intertwined.
Okay.
Because the focus is on primary health care service. The first focus is on primary health care services. And a large percentage of that primary health care service is around maternal care, maternal and newborn care. And so it is essential that there's the human resource in health, particularly at this stage, the midwives, to effect and to provide those services. So piggybacking on the challenges that he's enumerated, I can piggyback on that to enumerate the challenges that are being faced by the BHCPF as well. In the execution of in the drive towards its objective, achieving its objective, the BHCPF has suffered from the irregular disbursement of funds, because it's supposed to be a funding. However, I trust that things might get better. We are looking at things getting better in the horizon because of the newly signed in local government disbursement of funds at the local government level by the Honorable Minister of Justice Lateef Jakone. Sorry. Yeah. So that being signed into law would help to mitigate the irregular disbursement of funds. However, that is still a challenge. There's that existing challenge, because we have the federal government allocating the funds. Typically, the funds should be received quarterly, according to the arrangement or what was existing. But that comes sometimes to some states. Sometimes it doesn't come in that quarterly manner. So that once there are no funds to pay the midwives, to pay the nursing staff, to maintain the infrastructure, it just cascades into every other thing. So you can imagine that there's dilapidated structures. There's when you don't have staff that are going to carry out the primary health care to serve the people that are needed, then you have people not willing to come to the facility anymore, and then you have the continuing or declining rate of absorption of human resource, of people, of staff. So apart from the midwives, you also have other health workers who are now declining because they don't receive a remuneration for their services.
Great. To be part of our discussion, And also to tell us what you think or ask questions, you can call this numbers 0915 0910 482 or 0915 091 0483. You can also send your questions via WhatsApp on this number 0810 250 7579. We're also live on Facebook at the ICIR. So yeah, back to you, Joshua. You mentioned recruiting new midwives because the older ones retire and then they're leaving. So what other strategies would you say can be implemented to ensure the long-term sustainability of the MSS program?
So I will start from the obvious one in the house, which is the aspect of the funding, because that's where the gap exists. There seem not to be a very strong commitment of the government in terms of funding to the MSS, and so that's where you have the debt. The lack of funds has also not helped it to be very sustainable. The thing again is that, you see, healthcare system is not something you outsource, because you're talking about lives of human beings. You're talking about the lives of women, and in this case, it's actually a double jeopardy, because you are talking about the woman and the unborn child. And so there has to be a careful effort in terms of who is recruited as a midwife by the state government. So it's not something you say, since we're not getting midwives, we have to look for teachers that will come and serve as midwives. No. So what it means is that government also has to look, especially at the state level, begin to look at the nursing and midwifery councils at the various state levels, looking at the School of Nursing at those state level, to see what can be done. It is not, but in real sense, it's not that we don't have these people. There are people who are willing to work. The question is the state government willing to absorb these people, and then deploy them? And then, of course, the other aspect, which is also very critical, is the aspect of incentive for the midwives to be posted in primary healthcare centers that are far from city centers, because that's where the real issues happen. Most of the times, those primary healthcare centers itself are looking like, slaughterhouses. Apologies if that word does not sound, but that's the reality. Many primary healthcare centers don't have the facility. They don't even look like a primary healthcare center. And if you post a midwife to that place, she has left the comfort of her home to go and serve there. There should be incentive, something like a staff quarters, something that will make her willing to stay and contribute, in that community. So these are the things that will make it, sustainable. If government begins to put all those things in place, that way, not only are we going to, of course, it starts from recruitment. Not only would you have recruited people into the MSS system and then deploy them, but you also have the commitment of the staff who has been recruited to stay in those primary healthcare centers so that they can deliver the service that is required.
Yeah, thank you. Also, this is the network service of Radio Nigeria, and the program is Spark, brought to you by the International Center for Investigative Reporting, the ICIR, and supported by the International Budget Partnership, IBP, and we've been discussing the sustainability of the Basic Healthcare Provision Fund, the BHCPF, and the Midwives Service Scheme, MSS. We'll go on a short break, and when we return, we'll be taking your calls for questions and contributions. Kindly stay tuned.
Radio Nigeria.
To tackle pressing issues in our nation, such as unequal maternal health care services, gender-inclusive agricultural support for small-scale women farmers, access to loans and much more, the International Center for Investigative Reporting presents SPARK, a 30-minute radio program aimed at igniting discussions on these challenges and preferring solutions to them. SPARK airs every weekday on different radio stations across Nigeria. Mondays at 4 p.m. on Freedom 99.5 FM Kano, Tuesdays at 4 p.m. on Wazobia 93.7 FM Onisha, Wednesdays at 5 p.m. on all Radio Nigeria stations across Nigeria, Thursdays at 5:30 p.m. on Prestige 91.7 FM Mina, and Fridays at 5:30 p.m. on Splash 105.5 FM Ibadan. SPARK is supported by the International Budget Partnership, IBP.
And if you just tuned in, the program is Spark on the network service of Radio Nigeria, brought to you by the International Center for Investigative Reporting, ICIR. We're looking at the sustainability of the Basic Health Care Provision Fund, BHCPF, and the Midwives Service Scheme, MSS. Our guests have been Joshua Arugula, is a special intervention and evaluation specialist, and also we have with us Nene Oche. She's the healthcare quality management system consultant. So we have a call. Let's take that. Hello.
Hello.
Yeah. Hello. How are you doing? Please, what's your name and where are you calling us from?
Yes, I'm Olani Islabe calling from River State, from Port Harcourt precisely.
Great. Please go ahead with your question.
Yeah, I hope I'm onto the SPARK program, Strengthening Public Accountability for Reserve Knowledge.
Yes, you're right.
Thank you very much. On the issue of discussion today, I want to add my voice to the discussion. And one of the things I actually want to let people know, which is also important for us, is when we are talking about sustainability, there must be a deliberate effort on the part of government and every stakeholder in health care for the provision of these basic health care facilities. And the human resource aspect is very key. As a matter of fact, one of the positive documents of the National Primary Care Development Agency says that human resources for health are vital for the successful implementation. And it says that human resources constitute one of the most important resources in health and therefore demand effective planning and management for an efficient and effective PAC system to achieve better health outcomes. Unfortunately, this human resource, the government has not really done well in that area. And in many of our health facilities, we are not having the skill manpower, particularly midwives, who attend to pregnant women and people issues around pregnancy and things like that. Unfortunately, we have quite a number of midwives on the streets who are not gainfully employed. So government needs to really do more in deliberately engaging these midwives and deploying them to these health facilities, particularly at the basic health care centers, primary health care centers across the nation. That is where our rural dwellers will easily access health, and they will access quality care. But if you bring infrastructure, even if you provide state-of-the-art facility in all those rural areas without manpower, it amounts to nothing. So I call on government and all the stakeholders in the health to look at the human resources aspect and make sure that all our health facilities have the required human resources to ensure that all the citizens in the country receive quality health care. It is then we can talk about reduction in the maternal and child mortality. But if we don't address this human resource, acute shortage, particularly midwives and nurses.
All right, thank you. Thank you very much. Great. So you got to his contribution, right?
Yes, I did, and that was a pivot. What he said is actually accurate.
We have another call. Let's quickly take that. Okay. Hello.
Hello, can you hear me?
Yes. What's your name and where are you calling us from?
Hello, my name is Ogechi, calling you from Lagos.
Okay, Ogechi, please go ahead with your question.
Yes, I like the program. Thank you for it. I'm also a nurse.
Thank you.
I just want to ask the guest, how can the government improve compensations and working conditions for health workers, especially to retain them in rural areas?
All right, thank you very much. You got a question, right?
Yeah.
Okay. Can you guys answer?
Okay.
Let him speak.
Let's talk first about the human resource aspect you were to say.
Okay, great.
Yes, he raised the very pivotal point about the human resource need that cannot be undermined and cannot be put as secondary. And it's very much tied to retention that he's going to talk about very soon. Now, when you talk about sustainability and motivating human resources to be retained or to stay and be utilized and be equipped or brought in to the primary healthcare centers and the secondary healthcare centers, you should also look at he was saying that the government has to show its commitment, and I agree with that, because the 1% of the total budget that is supposed to be allocated that goes into the basic healthcare fund currently in this country is at risk because of the economic downturns. And if the funding, it's a 1% of the GDP. If our gross income in the country depreciate or deteriorate or goes down because of the economic downturn, automatically the amount of fund available to fund the primary and secondary healthcare centers automatically declines as well. And so we have to look inwards. We have to look at sustainable practices, not just paying lip service or waiting for the funds to be allocated. Because even when the funds are allocated, as supposed, even let's assume the funds get allocated and disbursed regularly as is expected, there are too many ups and downs. There are too many. It's too fluid. Because it is dependent on the income of the government, it becomes very fluid. So 2 things. Number 1, counterparts he mentioned counterpart funding. Counterparts, foreign investors want to also play a part. They also want to contribute. But here's the thing: they want to see the government work. They want to see the government put its money where its mouth is, not just signing stuff, but actually disbursing the funds, making them available. Then they would contribute as well. So once that minimum is being contributed, external people will also want to contribute. And then when they contribute, we now have to look inwards, like I was saying. Look at improving our practices, going lean with our practices, if building stronger systems within the healthcare service, so that when you go into it's not just about throwing money to a problem. I have a good mentor that says you don't throw money at every problem. Okay. So we go into the system and say, how are we operating here in the whether rural or semi or rural urban urban areas? How are we acting? What are we doing when people come into the facility? Is there management of funds? Is there management of resources? Working lean.
Okay, so let's go over to Joshua.
Yeah, so I'm just going to lend my voice on. The caller asked a very important question in terms of compensation. Unfortunately, in realistic terms, we can only advocate that the state government begins to take the initiative to pay all compensations they're supposed to pay to not only health workers, but also all staff, working with government, because this is where the challenge is. Those who have worked meritoriously 35 years and retired are yet to even collect their pensions, to receive their gratuities, and this does not give a high morale to those who are already in service. And so that's on one side of on the one hand. On the other hand, you're talking about the incentive that will make people leave the urban areas to go to the rural areas to go and work in those communities. And I think government should be intentional. And this is not like it's rocket science. This has been done before. We see how it was done in the past with education, where teachers were willing to stay in rural communities, and it also helped to galvanize the development of those communities in the time past. But unfortunately, of course, because of pull and push factors, people are beginning to move to the urban areas because the working conditions are not favorable in the rural areas. But let me also say something about the Basic Healthcare Provision Fund. I think state government needs to take the step, in accessing these funds. These funds are available. We see that many state governments are not accessing these funds. They are not playing their own part to access these funds. And that is sad, because this fund will go to the primary healthcare centers, implying that it is the community people that are going to benefit from it. And of course, the World Development Committees has a role to play, because their role is to provide an oversight, right, for the use, the utilization, the access and utilization of the fund at the primary healthcare center, working side by side with the health workers in the primary healthcare centers. We cannot overemphasize the role of recruitment. Right now, as we speak, many primary healthcare centers has 0 nurses. 0 nurses. So what you have is some kind of auxiliary people who are doing internships, serving in those primary healthcare centers. Some has only one. I've visited a primary healthcare center that has only one and just a few people who are supporting her. Those people are not under the payroll of the government. Yes. It's just something, maybe she gives them transport to come and help her, serving about 200 pregnant women. If we must reduce the incidences of maternal mortality and child mortality, then we need to recruit more people into the midwife service scheme and encourage state government to access this fund that is available so that the primary healthcare center can function for the people.
Yeah, great. And this has been a very, very insightful conversation. Thank you so much for joining us, Joshua Arugunyo and Nene Oche. And to your listener, we hope you found our discussion on the sustainability of the BHCPF and MSS enlightening. Remember, a healthy nation is a wealthy nation. Stay informed and stay healthy. Big thanks to the studio manager, Uche Enebili, and the producer, Vivian Onoweware, the engineer, Nwawe Onyebuchi, ICT, Jonathan Aino, and the ICR social media team led today by Fatumbi Olayinka and Abdul Gobre. Do join us next week Wednesday at 5 p.m. in the afternoon for another edition of Spark. Stay tuned for the next program. I remain Itoru Etikudo.
Not part of this thing. You just assist.